Hi, this presentation is on drugs used for the treatment of constipation. Mechanism of action of drugs used for constipation. Constipation is infrequent production of stools requiring staining to pass and with some sense of incomplete evacuation. Purgatives are drugs that promote defecation. They are also called laxative or cathartics. Laxative or aperients have milder action, while cathartic or purgatives have strong action. Many drugs in low doses act as a laxative, but in higher doses they act as a purgatives. All purgatives increase water content of stools by following mechanisms: by hydrophilic or osmotic action, retaining water and electrolytes in intestine lumen, increase volume of colonic contents, and making easy to pass the stool. Second mechanism is by acting on intestinal mucosa, decrease absorption of water and electrolyte. Intestinal transit is enhanced indirectly by fluid bulk. Third mechanism is by increasing pulsative action, which allow less time for absorption of water and salt. Laxatives modify fluid dynamics of mucosal cell and may cause fluid accumulation in gut lumen by one or more of the following mechanisms. First, by inhibiting sodium potassium ATPase of villus cell, impairing electrolyte and water absorption. So, by inhibiting it, sodium potassium ATPase, it impairs electrolyte and water absorption. By stimulating adenyl cyclase and increasing water and electrolyte secretion. So, stimulation of adenyl cyclase increases water and electrolyte secretion. By increasing Pg synthesis in mucosa, which results in increase in secretion. Next is by increasing NO or nitrous oxide synthesis, which increase which increases secretion and decreases non-pulsative contraction of colon. Next is by structural damage to absorbing mucosal intestinal cell. Coming to classification of drugs used for constipation, first class is drug. First class of drug is bulk forming agents. Examples are dietary fibers like bran, psyllium, spagula, methyl cellulose, and agar. Second class is stool softeners. Example, decusate sodium and liquid paraffin. Next class is stimulant purgatives. Examples, phenolphthalein, biscodyl, sodium picosulfate, castor oil, anthraquinones like Senna and Cascara sagrada. Next class is osmotic purgatives. Examples, magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, sodium potassium tartrate, and lactulose. Next class is 5-HT4 agonists. Examples, prucalopride and cisapride. Next class is opiate antagonists. Examples, LV-mopan and methyl naltrexone. Next class is chloride channel activator. Example, lubiprostone. Now coming to bulk forming agents. They include indigestible vegetable fibers and hydrophilic colloids that increase volume by absorbing water and swelling. By absorbing water, they swell and they increase the volume, and they lower the viscosity of the intestinal content, which softens the stool. By forming large, soft, solid stool, facilitates colonic transit. Dietary fibers consist of unabsorbable cell wall and other constituents of vegetable foods like cellulose, lignin, gum, pectin, glycoproteins, and other polysaccharides. Bran contains about 40% of dietary fibers. Osmotically active products are formed in the colon by bacterial degradation of gum, pectin, etc., which retain water. Some dietary fibers like gum, lignin, and pectin, they bind bile acids and promote their excretion in the stool. Psyllium and Ispagula contain natural colloidal mucilage, which form gelatinous mass by absorbing water. And this gelatinous mass ferments in colon, which increases bacterial mass and softens the stool. Methyl cellulose is semi-synthetic colloidal hydrophilic derivative of cellulose that remains largely unfermented in colon. Adding fibers to diet is a natural way of treating functional constipation. Adequate water intake should be advised with all bulk laxatives. These drugs may interfere with the absorption of other drugs. Disadvantages of bulk forming agents are large doses required and longer time is taken for action. Takes about 3 to 4 days. Now coming to stool softeners, first example is docusate, which is also called DOS, dioctyl sodium sulfosuccinate, which is an anionic detergent. It reduces surface tension, emulsifies colonic contents, and increases penetration of water in stool. It softens stool by net water accumulation in lumen by action on intestinal mucosa. By detergent action, it can disrupt the mucosal barrier and can increase the absorption of many unabsorbable substances like liquid paraffin. Next agent in stool softener is liquid paraffin, which is a viscous liquid, pharmacologically inert. It lubricates and softens stool. Next class is stimulant purgatives. They irritate intestinal mucosa, produce mild inflammation, and increase secretion. They increase water and electrolyte in lumen by altering absorptive and secretory activities of mucosal cell. They inhibit sodium potassium ATPase, which impair electrolyte and water absorption. Secretion is increased by PG or prostaglandin induced cyclic AMP activation. Senna and Cascara contains anthraquinone. Active principle act on myenteric plexus to increase peristalsis. They also promote secretion and decrease absorption in colon. Biscodil is partly absorbed and secreted in the bile. It is activated in intestine. It irritates mucosa, produces mild inflammation, and increases secretion. Sodium picosulfate is related to biscodil. It irritates local mucosa and activates myenteric neurons. Castor oil irritates mucosa, increases intestinal contraction, decreases intestinal absorption of water and electrolytes, and increases secretion by detergent like action. Now coming to osmotic purgatives. Unabsorbed solutes in intestine retain water osmotically and they distend bowel, produce pressure in bowel, and increase peristalsis indirectly. Magnesium ions release cholecystokinins, which increase motility and increase secretion. Magnesium salts are contraindicated in renal insufficiency. Lactulose, which is osmotic purgative, is a semi-synthetic disaccharide of fructose and lactose, which retains water. There is no digestion or absorption of lactulose in small intestine, and 1 to 3 days are taken for the action. Next class is 5-HT4 agonist. Example is prucalopride, which is a selective 5-HT4 agonist. It activates pre-junctional 5-HT4 receptors in enteric neurons, which releases acetylcholine, thereby promoting pulsative contraction in ileum and increases colonic transit. Stool frequency is improved in IBS or irritable bowel syndrome predominant constipation. chloride channel activators. Example is lubiprostone, which is a prostaglandin analog, AP4 receptor agonist, which stimulates chloride channel and increases intestinal secretion. Next class is opiate antagonist. Example is LV-Mopan. It is peripherally acting opiate, mu receptor antagonist, used for postoperative ileus or constipation. That's all in this presentation. Thank you very much.